Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. In 2016, an estimated 31% of deaths worldwide were caused by cardiovascular diseases. More than 75% of these were in low and middle income countries. That's according to the World Health Organization. Cardiovascular diseases, or CVDs, are the diseases of the heart and the blood vessels. According to the American Heart Association, about 25% of infants with heart diseases need invasive treatment in the first year of life. Congenital cardiovascular defects are the most common cause of infant death. My guest on the show today is a consultant pediatric cardiologist at Reddington Hospital, Dr. Emeka Ugu. You're welcome to the show, sir.
Thank you very much.
Time was whenever we spoke about heart diseases, we thought of adults. When did all this change, and what kind of heart problems do children have?
For children, the heart problems, they can have some form of heart problems that adults have. But because children are closer to the time of birth, so we expect that heart problems that are associated with problems at formation, when the child was still in the womb, will be commoner in children.
Okay.
So
the ones we call congenital.
Congenital, exactly. So the difference is that for children, we have more of congenital problems, things they are born with, and most of them are structural heart problems. That's by the structure of the heart, some problems, what is commonly called holes in the heart. Okay, so we tend to have much more of that. But of course, other problems that adults have, like hypertension, some infections in the heart muscles, we could still have them in children.
Let's just think about those ones that they have in common with adults. Now, experts say that symptoms in men are different from symptoms in women, that they are not exactly alike. Are the symptoms also different in children, and what are they?
Symptoms of heart problems in children are different, and actually it's very variable. It varies much more than in adults, because for a newborn, the symptoms are going to be different. For a child in infancy under 1 year, the symptoms are going to be different also. And then that continues to vary until they get into teenage and then get into adulthood.
So it looks like you never know, what you're facing.
Yeah, that's why it's very important for us to enlighten the public on the telltale signs of a possibility of heart problems, especially what they are born with, congenital heart problems in children. For instance, a newborn may just be having difficulty breathing, or may just be oxygen dependent. The child can't be taking off oxygen after delivery, which means the child can't live a normal life. That may happen for some days. The doctors may just put the child on oxygen, and then after some days, the child gets better adapted and is weaned off the oxygen and taken home. But there is need for that child to have some further evaluation for possibility of a heart problem. So
are there any conditions, heart conditions in children that don't come with symptoms?
So many of them are asymptomatic. They don't show any symptoms.
Wow.
Because the way, for instance, in the first 3 months, 6 weeks to 3 months of birth, the pressures in the lungs are similar to what you have in the womb. And then it keeps progressively getting lower until about the 6th week to 3rd month, when some heart problems will begin to manifest. So initially, some of them, you may not have any problem at all. And then the problems also would depend on the size of the hole, for instance. If it's a very small hole, there may not be any problem at all. You may not notice any symptom. If it's a moderately sized hole or larger ones, then you may see more subtle problems, more subtle symptoms. And then it may just be that this child is not growing well. A child, at 1 year, we expect the child to be about 10 kg. Then you may just see that this child is 7 kg at 1 year. It may just be that the child is having recurrent chest infections. Every time this child is just coming down with cough, and then he goes to the hospital, and they say the child has pneumonia. Because some blood fluid is flooding the lungs because of the hole. There's some shunting, some passage of water into the lungs. The risk of lung infections, recurrent lung infections are there. So when you're seeing, for instance, a child coming down with cough all the time, getting admitted for it, and then the doctor's possibly telling you that this is pneumonia, then it's very important for us to be sure that there's no heart problem in that child, especially if there is heart failure associated with pneumonia.
Okay, now, more often than not, if a child has a cough, the doctor you see is not a cardiologist. He's just, you know, some doctor, general practitioner or something like that. How difficult is it to diagnose a heart problem in a child, in a baby?
The field of cardiology, that's the study of the heart, management of heart diseases, including cardiac surgery, is relatively new. In fact, some 100 and maybe 200 to 200 years ago, a very famous surgeon had said that if you want to retain the respect of your colleagues, do not operate on the heart. So it was thought that it's not possible to do anything about the heart. So, but in the last few years, from about in the 60s, there have been tremendous development, knowledge, acquisition of knowledge and research and progress in heart surgery that less than 1% death is even expected now because of the proficiency and the development of heart interventions and surgeries. So we are expected to develop, the health practitioners are expected